All right, welcome to The Explainer. Today, we are talking about a real superhero of medicine, a drug that's been a total cornerstone in the fight against, well, one of humanity's oldest enemies, tuberculosis. And that really gets to the big question we're tackling today. How on earth does a drug that's, 70 years old, discovered way back in the 50s, still manage to be one of our most essential weapons in modern medicine? How does it do it? So to get a handle on our hero, Isoniazid, we've got to first size up its villain, the incredibly persistent and deadly disease, tuberculosis. So this drug, Isoniazid, you'll also hear it called INH, it was discovered back in the 1950s, and wow, it quickly became just indispensable. See, it's what we call a first-line antibiotic. That means it's our go-to, our primary and most effective weapon against TB, and it has saved an absolutely staggering number of lives. Okay, so what is Isoniazid's superpower? Where's the magic? Well, it's genius. It's all in this secret mission that takes place inside the enemy itself. Super cool stuff. All right, so Isoniazid is what's known as a prodrug. And the best way to think about this is like a secret agent, a spy. It goes into the body totally harmless, inactive. It needs to be activated to do its job. And here's the brilliant part. It actually tricks the tuberculosis bacterium into flipping the switch and activating it. The enemy literally arms the weapon meant to destroy it. So imagine this. Our spy, Isoniazid, slips inside the bacterium. Then an enemy enzyme, its name is CatG, it makes a huge mistake. It flips the switch and activates our drug, and boom, that unleashes its true power. The now active drug goes right to work, sabotaging another key enzyme called NHA, and that enzyme is the one in charge of building the bacterium's protective armor. And that armor we just mentioned, that's the target. It's made of something called mycolic acids. Just picture this thick, waxy fortress wall that shields the bacteria from our own immune system. So by stopping those acids from being made, Isoniazid is basically dismantling the fortress from the inside out. The walls crumble, and the bacterium just dies. Pretty amazing, right? But this hero drug is also incredibly versatile. It's not a one-trick pony. It actually takes on two very different but equally critical missions in the fight against TB. First off, let's talk about its journey through the body, which is just remarkable. Isoniazid travels pretty much everywhere. It reaches all our tissues and fluids, and it can even cross into the cerebral spinal fluid. Now, that is absolutely critical for treating the most severe forms of TB, like meningitis, when the infection actually spreads to the brain. So, because it can go everywhere, it can perform these two distinct missions. For an active TB infection, it's a team player. You always use it with other drugs. That's to stop the bacteria from developing resistance. But for latent TB, that's where the bacteria are just sitting there dormant. It goes on a solo mission. It's used all by itself as a preventive therapy for months, just to wipe out the threat before it ever gets a chance to wake up and cause disease. But, like all great heroes in the stories, Isoniazid has a tragic flaw, a dark side, and it's a side that can cause some really serious harm if we're not super careful. Okay, so the number one most dangerous flaw is its potential to damage the liver. We call this hepatotoxicity, and it can be severe. It can also cause something called peripheral neuropathy. That's nerve damage, usually in the hands and feet. And we know why this happens. The drug messes with how our body uses a really crucial nutrient, vitamin B6. So the obvious question is, how do we manage this danger? How do we use the hero without getting hurt by its dark side? Well, fortunately, we've got some smart strategies to basically shield patients from our hero's own destructive potential. First, we give our hero a sidekick. Yep, vitamin B6 is routinely prescribed right alongside Isoniazid, specifically to prevent that nerve damage we talked about. And then you have mission control. That's the doctors. They keep a really close eye on liver function with regular blood tests. They're making sure the mission stays safe, and they're ready to pull the plug if there's even a hint of trouble. But the story doesn't stop there, because the biggest threat our hero faces today is that the villain, it's fighting back. It's adapting. It's learning how to defeat Isoniazid. And here's how a critical weakness shows up. Remember how he said it's a team player for active TB? Well, if you use Isoniazid alone to treat an active infection, we call that monotherapy, you're basically giving the bacteria a perfect shot to evolve and become resistant. And that is exactly why it has to be part of a team for active TB. So how does the bacteria do it? It fights back with a really simple but totally devastating trick.
It mutates that CatG gene. Remember that? The enemy enzyme that our secret agent needs to flip the on switch? Well, if that gene is mutated, the spy can't be activated. It's rendered completely powerless. It's like our spy gets to the target, but the enemy has changed all the locks.
And this, unfortunately, leads us to the arch nemesis, multi-drug-resistant TB, or MDR-TB. When TB becomes resistant to Isoniazid, that is a defining feature of this much, much deadlier form of the disease. It's incredibly difficult and expensive to treat, and it requires way longer, more toxic combinations of drugs. So that brings us to our final thought for today. Look, Isoniazid is an absolute pillar of modern medicine, a true superhero drug, no question. But its story is this constant balancing act, right? Between this incredible benefit and some really significant risks. And it's all happening under the growing shadow of resistance. So the real question is, as our old hero faces a new and changing villain, what comes next? Who's going to be the hero of tomorrow?